Hey guys, so today I'm going to give you tips for interviewing on a specialized nursing unit. So let's get started. So I was recently hired onto the emergency unit at the local hospital I work at, and beforehand, obviously, I had to go through a rigorous interviewing process. I couldn't really find any tips for nurses that are getting interviewed for either a training opportunity or working into their specialized unit. So in this video, I'm going to talk about ways you can improve your nursing interviewing skills going into these interviews. So the first tip I would give a nurse going into a specialized unit is you're going to have to identify different situations that are going to come up onto your floor. So situationally based questions were definitely a constant reoccurring event during my interview. And obviously, different nursing floors have different situations that they're going to ask you. So, for example, onto the emergency unit, they always asked about how do you deal with family members. This is the first time they come into contact with the public healthcare system here in Canada. So they're going to ask a lot of questions about family. They're going to ask a lot of questions about patient safety. They're going to ask about your safety. They're going to ask about different culturally appropriate cares, trauma-informed care, all these different things that they're going to put into a situation and you're going to have to answer. So the second tip I would give for a nurse going into their specialized unit is to know their nursing interventions for that floor. So obviously, for example, onto the emergency unit, I have to know about immediate interventions to provide a patient who's deteriorating. So putting in an IV, starting an IV bag, providing dopamine, epinephrine, whatever, all these injections, having them ready to go so that when the doctor gives me the order, I can provide the nursing interventions. Now, obviously, different floors have different nursing interventions, and what you really want to do going into that interview is know what the nursing interventions are for the nurses that need to provide immediate interventions in a emergency situation. That's very important. That's definitely going to be talked about on your interview. So the third tip I would give a nurse going into their interview is think about ways you can make a nursing unit better. When a manager asks you to work onto that floor, they want to know that you'll not only be reliable, but you'll also be able to make a positive impact onto that unit. So you really got to know, how can you make a nursing unit better? So one of the questions they asked me was, during the time you've worked on your unit, how have you made your unit better? How have you improved patient safety? How have you improved the efficiency? How have you, for example, reduced costs? All these different questions, all these different answers are what they're kind of looking for. How could you have made the unit you're working at better? Because ultimately they want their unit to be better and they want to create a better environment each and every single year. So the fourth tip I would give to a nurse going into their specialized nursing interview is you have to know your competency for each of the nursing skills. So, for example, how competent are you in putting an IV? They're going to straight up ask you to rank them from 1 to 5. How competent are you doing wound care? How competent are you doing trach care? How competent are you providing immediate interventions? How competent are you in a code blue situation, a code 77, which is a stroke here where we work at? How competent are you in providing treatments for those types of patients? So they're going to ask you to rank your competencies. Another thing was they asked about ECGs. That was huge. How competent are you in reading ECGs? Because obviously there are a lot of cardiac issues. So the last tip I would give for a nurse going into their nursing interview to work on a specialized unit is they're going to definitely ask you how you work with others. They're definitely going to ask you a situationally based question on that, and I'll explain that more in detail. But first I want to say they're going to want to know how well you work with colleagues. They're gonna want to know that you're flexible, that you're willing to learn, that you're eager to learn, and the senior RNs onto that unit, they want to make sure that they feel like you're a good pick, because obviously if they don't feel that you're a good fit onto that floor, they're not going to teach you as well, and ultimately your experiences onto that unit are not going to be great. So they really want to know how you're able to work with others. The last thing I want to mention is they're going to ask you a situationally based question on a nurse that's not doing too well at their job. So one question they asked me was, you notice that a nurse is on their phone and their patient is unresponsive. You go into that room, you notice that the patient's unresponsive. What do you do for the patient, firstly? And secondly, what do you do to not have that happen again? And obviously they want you to know that, they want to know that you know not to, obviously let the patient die first. But the second thing is they really are asking how you're able to tell that nurse that you can't be on your phone during your shift. You can't, you gotta really improve your nursing skills, so to speak. And how are you going to be a better nurse? You need to figure out how you're going to communicate that to them as an RN, because you ultimately want to promote patient safety onto that floor. And that's the final tip I would give for you guys. So there you have it, guys. Those are 5 nursing interview tips that I would give for a nurse going into a specialized unit. I hope you guys enjoyed this video. Please give the video a thumbs up if it had helped you at all. Please share it with your friends and subscribe, guys. I'll be posting a video every Sunday, so see you guys next time.